Good evening. I'm Tanisha, and this is an in depth exploration of EMDR. We will define EMDR. We will discuss the causes of the dysfunctions. We will explore the therapy model. We will also discuss the implementation of EMDR, including the role of assessment, the role of the therapist, the role of the client, and the role of therapy goals, as well as the technique. We will explore demonstration. We will additionally critique EMDR and discuss additional resources. So, what is EMDR? Watch this quick clip, and I'll be right back with you. Eye movement desensitization and reprocessing was developed by Francine Shapiro in 1987. She defined EMDR as an adaptive processing model that explores presenting symptoms as manifestations of unprocessed memories and asserts that symptoms only dissolve when memories are resolved. EMDR addresses past, present, and future aspects of disturbing memories. She discovered EMDR after reporting that during a walk in the park, she noticed how recurring disturbing thoughts arose and then disappeared without intentional effort. She explained that careful self-examination led to the realization that her eyes were involuntarily moving in a rapid manner as disturbing thoughts arose. Then the thoughts disappeared completely. And then when she brought those disturbing memories up again, they were no longer upsetting. Now, the adaptive information processing model suggests that our brains process and store information in an associative memory network. These networks link memories through connection that form coherent systems. Now, under normal conditions, these networks are adaptive, meaning that they retain only information that's useful, like knowledge that supports decision making and actions that promote survival. However, traumatic events can disrupt this process, leaving certain memories unprocessed and stored in a maladaptive way. These unprocessed memories are often tied to sensory elements like images, sounds, smells, our five senses, can persist and contribute to symptoms like PTSD, including like flashbacks and intrusive thoughts. The AIP model also explains how an EMDR therapy works to resolve PTSD symptoms. During treatment, clients focus on traumatic memories while engaging in dual attention techniques like eye movements. These techniques may stimulate the brain's natural ability to process maladaptive memories, potentially by improving communication between different brain regions, or by reducing the vividness and emotional intensity of the memory through working memory hypothesis. As this process unfolds, new and healthier associations are formed between the traumatic memory and the adaptive thoughts, allowing the memory to be reprocessed in a way that kind of integrates into the individual's broader network of experiences. Now, what causes dysfunction according to EMDR? According to this theory, when a trauma or negative experience occurs, information processing may be incomplete and it blocks the information from processing properly. This is due to the intensity of the negative emotion and dissociation that may occur as a result of the negative experience. This presents the forging of the connection with more adaptive information that is held in other memory networks. is my favorite part, bilateral stimulation. Now, this is very crucial to EMDR. Studies have shown that providing bilateral stimulation increases the effectiveness of EMDR. It aids the memory, recollection, and increases the feeling of relaxation. This stimulation can occur in a variety of forms, including left to right eye movements, tapping on the knees, headphones, and handheld buzzers known as tappers. Now, I use butterfly tapping, which is you cross your arms and tap like this, back and forth. This is not really traditional EMDR, but I also encourage rocking if that's what's comfortable for the client. I encourage the client to use whatever's natural for them that kind of helps to stimulate the brain, whether it's rocking back and forth, tapping your shoulders, tapping your knees, whatever feels comfortable and culturally acceptable for my client. There are 8 phases, which we will talk about: patient history, preparation, assessment, desensitization, installation, body scan, closure, and reevaluation. Now let's talk about implementing EMDR, utilizing the 8 phases protocol. Once again, there are 8 phases. The first phase is the patient history. Now, this occurs over the course of a few sessions, and it could extend throughout the rest of the therapeutic process if something else comes up, like a new trauma or a new stressor. And it doesn't necessarily have to be a trauma or a stressor. It's just something that is important to that client in that moment that they like to process. This includes assessing the behaviors associated with the problem, and the symptoms associated with the problem. And we identify this as the target event. And to get that information or to assess that, we use assessment tools like the intake questionnaire and diagnostic assessments, just traditional intake techniques and modalities. We also identify past events that created the problem or the target event, current events that intensify the symptoms, and strategies to promote well-being in the future. So we're focusing on the past, the present, and the future. The second phase is the preparation phase. This is where the foundation of trust is established between the therapist and the client, which is very important. The therapist has to be in tune with the client. The therapist's job is to create a safe space for the client. The therapist explains each step of the process clearly and concisely. This is where we also practice eye movements and other bilateral movements that's the client finds comfortable and practical for them. We also implement body resourcing. So if a client becomes dysregulated, they're able to utilize that body resource in order to bring them back to equilibrium. And this can also be relaxation techniques, breathing techniques, and things like that. I also like the 4-7-8 breathing for body resourcing as well. The next phase is the assessment phase. This is where the client has an image They find an image that represents the trauma or the stressful event or memory. Um, the client actually vocalizes the negative assessment and identifies the emotion and body sensation associated with that negative assessment. The client chooses, um, the client then chooses a positive self belief that reflects the facts regarding the present moment. The client then rates the positive statement using validity of cognition, one being not so great, and seven being great. And then back to body sensations, the SUDS, how that, where they feel, what they feel in their body, and how intense it is. So if they feel the intensity in their chest, they identify that they feel, I guess, the sadness in their chest, and the intensity level on a scale of 1 to 10, they'll say it's either a 4 or 5 or 10. 10 being the greatest intensity, 1 being the lowest intensity, and 0 being none at all. The next phase is the desensitization phase, and the therapist here leads the client in a series of bilateral stimulation movements. They are installed. This is where they practice again the bilateral stimulations, like the tapping, the eye movements, and again, like I stated before, whatever feels comfortable for the client, where they're just kind of moving back and forth, whether it's rocking back and forth, tapping their knees, tapping their feet, using the clickers, just whatever feels right for them. The client will experience 2 positive or neutral responses to the targeted event. And then they will rate the body sensation. They will identify the body sensation as it pertains to the memory on a scale of 0 to 10. Now, this is the installation phase, which is the next phase. The client will identify the positive belief, and here they see the negative belief about the situation or themselves as an illusion and fictional. They focus on the fact or the positive belief. The positive belief is reaffirmed, and the positive cognition is again introduced and emphasized until the VOC is rated a 7. We always want to get the VOC to a 7, and we also want to get the SUDS as low as possible. The positive thoughts are accepted here, and it's internalized as the truth. The next phase is the body scan. The client thinks of a target event. Thinks of the targeted event or the trauma or the stressor. The therapist then assesses the body sensations again, the SUDS, the physical sign, and they see if there's any physical signs of distress or discomfort. And if there is continual distress or comfort, then they will reprocess until the positive belief is at a VOC of 7. The next phase is the closure phase. There are two possible closure phases, and one is the completed target memory session and the incomplete target memory session. The complete is it's self-explanatory. With the incomplete target, the memory occurs when the client has not. The incomplete target memory occurs when the client has not achieved 2 positive or neutral responses to the trauma or stressful event. The therapist then needs to lead the client through relaxation technique in order to control the symptoms after the session, because they are likely dysregulated, and you don't want the client to go home dysregulated. That can cause just cause all kinds of it could just go wrong. So you want to make sure they have some techniques to take home with them so they can self-regulate. Um, the client is also encouraged to kind of journal and document their experiences, and again use their tools, their coping tools, if they're triggered, um, just with everyday life circumstances. And then the last phase is the reevaluation phase. Each session will begin with a reevaluation. And this will be a review of the current emotional and mental state, the response to the process, thoughts that have come up since the previous session, and address any new needs or new experiences. So even though this is seen as 8. This actually occurs like at the beginning of the next session. Here is a sample EMDR session. It's really good. So, how well supported is EMDR? EMDR has had over 30 published randomized control trials demonstrated to demonstrate the effectiveness of EMDR in both adults and children. What aspects of the theory need further research? The EMDR Research Foundation identifies 3 areas of research priority for the modality. One is the advanced evidence-based practice. The next is addressing the global burden of trauma, and the last is building clinical evidence. And if you want to click on the link provided below, it'll provide more details as to where they want to continue to do work in expanding EMDR research. How well does the theory address faith and cultural dimensions? EMDR is a client-centered, and it builds on existing cultural resources and beliefs. So wherever the client is, as far as spiritually, as far as culturally, EMDR can fit that client where they are, whether it's Christianity, whether it's whatever. EMDR is very flexible in meeting that need. Now, how compatible is this theory with Christian worldview? The American Association of Christian Counselors says yes, it is very compatible with the Christian worldview. EMDR can be especially beneficial to Christians because it can help them process traumatic experiences in a way that aligns with their faith. Christians can struggle with the idea of surrendering their pain and trauma to God, according to the American Association of Christian Counselors. They may feel guilty or ashamed for being unable to trust God and move on from their trauma. EMDR can help Christians process their trauma in a way that acknowledges their pain and validates their emotions, while also allowing them to surrender their pain to God. EMDR can also be beneficial for Christians who experience spiritual trauma. Spiritual trauma can occur when a person has experienced abuse or mistreatment within a religious context. This can lead to feelings of shame, guilt, and confusion about one's relationship with God. EMDR can help Christians to process their spiritual trauma in a way that allows them to separate abusive and harmful experiences from their faith. This can help them restore their relationship with God and heal their spiritual wounds. And this, again, is according to the American Association of Christian Counselors. Here are the references if you guys want to go back and read more into EMDR, especially the actual EMDR website, Amidria website, the EMDR Institute, as well as the the EMDR Institute. My apologies. The website is here, but if you guys have any additional questions, feel free to reach out to me. I'm still fairly new to EMDR. I'm EMDR trained, but not EMDR certified. But I am working toward certification. So if you have any questions, please feel free to reach out to me. That's it. Thank you.